Today, I am joined by a true pioneer in the area of 3D imaging and dental sleep medicine, Dr. Bill Harrell.
You can see a child walk in the room and tell if they got an airway problem.
The first thing we look at when we look at a patient should not be their teeth.
Dr. Gimeno said, if you do not establish nasal breathing in a child, you have not treated that child. A child should not snore, even a little bit.
Even a little bit.
More of the intellectual centers of the brain were stimulated doing nose breathing and less during mouth breathing. Even though they don't have crossbite, they may have narrow skeletal issues. And if you got something less than 30 millimeters of intermolar width between the molars, it's highly, highly correlated with sleep apnea. Okay. It doesn't matter about a crossbite because that's what everybody looks at.
Thank you.
The academics have looked at it and said,
yes,
well, if there's no crossbite, there's no reason to expand. The problem is we're looking at a lateral ceph, a 2D lateral ceph, and a 2D panoramic X-ray.
If the residents aren't treating these patients the way you're talking about and looking at these things, then I feel like there's a big deterrent to them to ever start to do it once they leave school and go to private practice.
A lot of stuff going on that I think will eventually help answer some of these questions in the right way, have the data that we can actually hang our hat on. A lot of this literature, it's not in our literature, it's in medical.
Yeah, agreed.
And, we think we orthodontists are just trying to sit here dealing with pretty teeth and we're dealing with some heavy duty stuff here, and we need to try to realize it, and we need to work with medical professionals. ENTs and orthodontists should be tied at the hip. When I started having a dream about this book, I said, I want to write a book that kind of puts medicine and dentistry back together in the airway, because that's really where we overlap. It's hard to get polysonography on kids, and most sleep clinics don't do children. Most of the children have upper airway resistance, which doesn't show up. Take an image of the face and actually have the AI analyze it, spit out a report and say, maybe this patient has 5 or 10 or whatever of the 30 or 40 biomarkers that are quantifiable, and you could track them over time. How cool would that be?